In this video, we will discuss bleeding inside the body, known as internal bleeding. Like external bleeding, internal bleeding is caused by trauma or injuries. Internal bleeding may also be caused by medical events, however, that is discussed in the course on medical emergencies. Internal bleeding is the result of injuries to tissues and vessels inside the body. Blunt trauma to the body leads to that energy being absorbed by the body and transferred internally. This energy wave inside the body does damage to tissues, organs, and vessels, which can lead to internal bleeding. As mentioned in the previous video, arterial bleeding is the most serious form of bleeding as arteries are under high pressure. If arteries are damaged and bleeding internally, a patient may bleed out quickly without any sign of external hemorrhage and can die. This makes recognizing internal hemorrhage tricky. Penetrating trauma can also cause damage to organs and vessels, leading to internal hemorrhage. Any organ which is highly vascular, that is, has a large volume of blood moving through it, can lead to severe internal bleeding when damaged, which leads to shock and death if left untreated. Blunt and/or penetrating trauma may damage vascular organs, leading to internal hemorrhage. Think of organs like your heart and brain, the lungs, the spleen, the kidneys, and the liver. These are all organs which, if damaged, can bleed significantly, leading to hemorrhagic shock and even death. Another part of the body that can bleed significantly are the bones. Closed fractures or bone breaks which do not penetrate the skin from the inside may also be associated with internal bleeding. Your pelvis has large and central arteries and veins running through and around it. A serious pelvic fracture may lead to damage in these vessels and serious internal bleeding. Splinting a pelvis is the best form of pre-hospital treatment for this type of internal hemorrhage. As you can imagine, any injury to the thoracic or abdominal aorta will lead to a swift blood loss and rapid progression to shock and death if not treated. Back pain between the scapula, central chest pain or epigastric pain, or central abdominal or lower back pain may be indications of aortic bleeding. Be sure to consider areas of pain, rigidity, pulsation, or bruising which may indicate injuries to the aorta. Because internal hemorrhage may not be apparent at all, we need to review specific assessment goals for the patient who may have internal hemorrhage. The first part of the assessment is to recognize that a traumatic event has occurred in your patient. In a lone patient who is unresponsive, a mechanism of trauma may not be obvious. Quickly ascertain if you believe trauma was involved. If you see signs of external trauma on rapid physical exam, assume then that internal injuries may be present. If you have the specific mechanism of injury available, consider how severe the energy transfer was during that mechanism. Did a person fall from a standing position or off of a roof? Did they land on soft grass or hard concrete? While any trauma can cause internal injuries, generally the greater the external energy absorbed by the body, the worse the potential for internal injury. Examining skin signs is an important indicator for internal hemorrhage. As the body progresses through the stages of shock, distal blood flow will be shunted centrally and internally to compensate. Thus, the skin will appear pale, cool, and clammy, which should alarm you that they may be in shock. External bleeding from the ear canal, nose, or mouth, not caused by a direct injury to those areas, may be an indicator of severe intracranial bleeding, or bleeding inside the brain. These patients are usually not responsive, have distressing vital signs, and may have other external injuries to indicate a high mechanism of trauma occurred. These patients are critical and require rapid transport to a trauma-capable facility. Let's also consider what severe hemorrhage depends on. We know that arterial bleeding loses blood more quickly than venous and capillary bleeding, but remember that the patient's age, size, gender, and other medical conditions may affect this relationship. Pediatric and some elderly patients have a much lower total blood volume, and thus a small amount of blood loss may be proportionally more significant to them than it would be in an adult. A patient with any clotting disease may be at higher risk of hemorrhagic shock from an otherwise minor mechanism of injury. Consider too whether your patient is taking blood thinning or anticoagulation medication, which puts them in a high-risk category for any injury. Lastly, make sure to keep any patient with hemorrhage warm. Hypothermia is a leading cause of clot formation disruption, which leads to worse outcomes for the trauma patient. This means that if your patient is cold, their blood may not be able to clot, and thus they will bleed further. Trauma patients are often exposed in the elements, sometimes for long periods of time. They're often sick and injured and unable to warm themselves, and then become further exposed by healthcare providers trying to treat them. Once exposure has been accomplished and assessment and treatment are finished, cover your patients with blankets, turn the heat on in their environment, and keep them warm. While it may be more challenging to recognize than external bleeding, Internal bleeding is also a life-threatening occurrence at times. Evaluate your patient as you normally do. Look for signs of trauma. You may even see ecchymosis or skin bruising that may indicate internal bleeding. However, if you suspect trauma and the patient is in or moving toward hemorrhagic shock, the most important thing is to transport to a trauma center.